Hello, my name is Kyran Clopton, and I am a third-year student health ambassador with the Meharry Medical College HBCU Wellness Project, and my project is entitled Building Healthy Beginnings, a study on infant and maternal health. So the basics of my project was to focus on postpartum depression as well as sudden infant death syndrome in African American men and women communities. So the impact of my project was by attending a virtual event that focuses on infant mortality, the knowledge and behaviors of these participants can dramatically increase. Since African American men and women are disproportionately affected by postpartum depression as well as SIDS, this event can provide information that this population typically does not receive. Even more, if attendees implement preventative measures shared at this event, infant mortality rates among this community can decrease. So the recruitment for my project was my flyer was shared on social media, including Facebook, GroupMe, as well as Instagram, and it was a Zoom held on November 25th. So my community partner for this project was Dr. Leah Alexander of Meharry Medical College, who focuses on maternal infant health within their global health program. At my event, we had 22 attendees, and they were asked to fill out a pre and post test regarding their knowledge on infant and maternal health. Some ill-informed facts that we learned from these pre-tests regarding how much they knew on infant and maternal health was, one of the questions that was asked was, I'm aware of the major causes of infant mortality in the United States. Only 40.9% of attendees were even neutral in this topic, as well as less than 20% of attendees agreed or even strongly agreed with this statement. I feel confident identifying ways of women's health before pregnancy. Only 50% of attendees in this topic were neutral, and only 27% could even agree with this. And then one of the other major drastic increases in knowledge regarding our pretest was, I understand how structural racism and community inequities contribute to disparities and infant mortality. Only 45.5% of attendees were able to agree with this statement, and 27.3% were neutral about this topic, as well as 13% either strongly agreed or disagreed as a whole. So some frequently asked questions after the presentation was, what can fathers and men do to support mothers and promote infant health? Dr. Alexander explained how important community is when a mother has just given birth, not only just to the baby, but also to the mother, because she's trying to get her groove back, just giving birth, because giving birth is a lot on someone's body. The next question that was asked was, how does infant mortality rates differ among predominantly white areas versus minority communities? Dr. Alexander explained how typically infant mortality rates can be higher in minority communities, mostly due to the lack of education that comes with infant as well as maternal care. And then what are the telltale signs that a mother can experience postpartum depression? Dr. Alexander spoke about how if a mother has a change in her typical moods or routine, or if a mother is lacking motivation to take care of herself or the baby, that she may be experiencing postpartum depression. And then what are some things that mothers should know before breastfeeding? Breastfeeding does tie into the importance of infant health directly. A mother should be taking care of herself, practicing healthy methods when it comes to healthy dieting, as well as refraining from smoking or heavy drinking, because a healthy mother equals a healthy baby. And then another question was, how does postpartum depression tie directly to SIDS and infant health? It is shown that with postpartum depression, if a mother is lacking the motivation to take care of herself, take care of the baby, then they may not have the motivation to practice safe sleeping habits that a baby needs that prevents them from having SIDS. So with safe sleeping habits, that includes make sure that the baby is sleeping by themselves, no comforter in the bed, no toys around them, as well as making sure that they are laying in the correct position so that a baby is not asphyxiating itself. So the takeaway and key points from my event was this informational presentation was able to raise awareness about risk of infant mortality, increase knowledge on ways to decrease SIDS and postpartum depression, and expand familiarity with resources that provide knowledge on infant mortality in the national area at a reduced to no cost rate for mothers as well as minority women. Overall knowledge from my project increased by 25.75%, with a 48.9% improvement in understanding strategies to reduce SIDS risk and support pre and post maternal care. Also, these findings indicated that targeted, culturally responsive education can meaningfully embrace maternal and infant health awareness within underserved communities. Thank you once again for listening to my project.